Hi everyone, I'm Congresswoman Katie Porter. I'm sorry I couldn't join you in person today. Throughout California, doctors are spending less and less time with their patients due to the corporate practice of medicine. Now I know that everyone here today is likely familiar with this concept due to your work, but our challenge as advocates is to bring more people into our movement. We need to explain terms like corporate practice of medicine, because the reality is that many Americans experience its harms as patients without even realizing it. Here's how we can explain it to someone. Imagine that you've been experiencing some strange symptoms lately. You easily make an appointment with your primary care doctor, who then refers you to a specialist. This is where the problems begin. The specialist you were referred to is part of a large healthcare system. Even though your primary care provider made a referral, it takes you months to get an appointment. When your appointment finally rolls around, you have to spend 20 minutes past your appointment time waiting to even be called back by the nurse. The nurse takes your vitals, leaves you waiting another 20 minutes to see your doctor. You waited months to get an appointment, wasted time in the waiting room, and had a $50 copay, only to have your doctor then spend less than 10 minutes with you. You like the specialist, but leave feeling incredibly frustrated by how little medicine the doctor actually got to practice with you. What you may not see is that your doctor is also frustrated that they can't spend more time with you. But the large healthcare consortium that employs them recently changed its policies to limit the amount of time doctors can spend preparing for appointments, making referrals, doing necessary paperwork, and spending time with patients. As a result, your doctor has back-to-back appointments because others have left practice due to these policy changes, and the health system isn't hiring additional staff. When the staffing and schedule is set by a large health system, everybody loses. This is the corporate practice of medicine, where large corporations, such as insurance companies or private equity firms, employ physicians to provide medical services to maximize profit, not provide the best patient care. The most common way patients experience the corporate practice of medicine is through how much or how little time doctors spend with them. Corporations stretch their medical staff thin, cramming doctors' schedules at the expense of both patients and providers. Now let's zoom out and see this on a bigger scale. You think that the healthcare decision you're receiving is a decision that is just between you and your doctor. But wait, there are actually two other entities who are influencing the care you receive. Big insurance, who we all know, creates additional hurdles to receiving care. And the large corporation that owns the insurer and hospital at which you receive care. Now you have to navigate the maze of big insurance and healthcare corporations just to reach your doctor. The corporate practice of medicine creates barriers to patients receiving the care they deserve. When you go to the doctor, you want them to be responsive to your individual health needs and act in your best interest. But under the corporate practice of medicine, doctors are constrained and beholden to the corporate interests of shareholders instead of their own medical expertise. Unfortunately, today, the majority, nearly 3/4 of physicians are employed by large corporations. Doctors increasingly have their hands tied. They are forced to make difficult decisions between meeting the requirements imposed on them by their employer and their code of ethics. To make matters worse, corporations silence doctors and threaten to derail their jobs and careers if they speak out for patient safety. I want to share the story of Dr. Ming Lin, who was wrongfully fired for advocating for improved protective gear and safety measures at his hospital in the midst of the COVID-19 pandemic. During a time when hundreds of thousands of people were dying, the hospital that employed Dr. Lin chose to be selfish. Instead of purchasing personal protective equipment, they terminated one of their doctors to protect their profits. This is unacceptable. Physicians employed by large healthcare corporations don't have protections if they speak out against this kind of corporate abuse. The corporate practice of medicine has infected a whole field of medical fields, including dialysis, nursing homes, primary care, emergency medicine, and the list goes on and on. Private equity has been consolidating medical practices and contaminating healthcare with increasing profit motives for decades, right under our noses. Many states have prohibitions on the corporate practice of medicine, yet the problem is still getting worse. I'm proud that California is leading the way to fight these abuses with a lawsuit against the Envision Healthcare Corporation. Without adequate enforcement, we all lose out. Corporations are going to continue pushing the boundaries and disrupting needed patient medical care unless we act. Just like any market, healthcare functions best when patients have choices. Private equity's consolidation of medical practices and pivot toward profit-driven care harms patients and healthcare workers. Healthcare profits shouldn't come at the expense of patient well-being. We cannot allow private companies to dictate the level of care doctors are able to provide or punish doctors for standing up to their patients. Thank you for inviting me to speak today and joining me in this fight. Together, we can build a healthcare system that delivers the care that Americans need and deserve.